This session kickstarts the social sector PPPs, and we're starting with a fireside chat. Just by way of a quick introduction, in the last session, Mr. Ahmed Al-Hammadi was asked where he sees the growth sectors, and he said that it's going to be in the social sector, in hospitals and in education. And this is possibly why in this particular WAP forum we have a total of 6 sessions dedicated for the social sector PPPs. And I can't think of a better person to kickstart this with me than Karine Bachongy. I was going to say welcome to the UAE, but it's actually welcome back. I know you spent many years here. Karine and I know each other from several years ago, and Karine heads the PPPs transaction advisory service for the International Finance Corporation, which is part of the World Bank Group. So I can't think really of a better person to do this with. Karine, how do we define the social sector? What are the different things that fall under a social sector?
So is it working this way, or should I press on?
I think it's already live, yeah.
It works?
Yeah.
So at the World Bank, we define social sectors as being healthcare, education, affordable housing, and everything which is sort of around these 3 areas. So it's quite a large sector nowadays. About 10 years back, we just had a couple of projects in healthcare, and that would be it. Now it constitutes 30% of the PPP transactions that we deliver.
Wow.
So quite a substantial number of projects. Because we have, it's I think now 12 years of experience overall in this area. We have a lot of lessons learned to input in the projects. But because we actually work with conceptualization, your company, yes, on a number of them.
Indeed. And what is interesting is how much social sector projects are actually being done in the region as well. I mean, of course, we're in Abu Dhabi. In Abu Dhabi, they've done schools PPP, and now they've launched the student accommodation PPP. So we're seeing it in several, in Saudi, of course, schools and hospitals, but also recently courthouses. So there's been a tender for courthouses. So that's kind of extending also the definition more broadly of social sector PPPs. So what do you consider to be special about social sector and the PPPs around it?
Oh, well, okay. I mean, the panel just before talked about the effect of the pandemic. I think when it comes to healthcare, I don't even need to justify. So many governments are now reaching out, trying to develop healthcare PPPs, trying to sort of upgrade public health services with the help of private partners. Mm-hmm. So, I mean, you touch upon the very basic needs of a population, in fact, right? Mm. I mean, human capital, that's a country number 1 asset. Yes. So that's what is very, very special. When you talk about education, for example, so again, that's a basic need. It has a direct impact on basically poverty levels, a direct impact on the ability to move socially. Mm-hmm. But it also impacts the competitiveness of a country, right? If the workforce is educated and sort of productive. So now if I speak about housing, that's mm-hmm. another subject which is sort of perhaps less known, but growing very fast. Some statistics reckon that 1.6 billion people do not have access to adequate housing. Mm. So that gives you the dimension of the problematic in social sectors, and again touching upon the very, very basic needs.
Yeah, and that of course generates a certain expectation in people, in citizens, about the provision of social infrastructure and social services.
Yes, that's very true. And the expectations are very high, and from my humble point of view, rightly so. Mm. You can never reach actually expectations. I'm from France, maybe you hear from my accent, but even there, people say that the health system is not functioning as it should. But anyway, let's be very precise. You have the Social Development Goals number 3,
Yeah.
which says that by 2030, we should reach health for all, even more than health, wellness, well-being. Sorry.
Yes.
And access to vaccines, access to pharmaceuticals. So all of that is very precise, and I think expectations should be measured by this.
Yeah.
I was reading lately also in the Lancet very interesting stat that you have a huge discrepancy in life expectancy between high-income countries and low-income countries of nearly 20 years. So this is striking,
That's
right? And that gives, I think, some dimensioning of where expectations should lie.
Yeah, yeah. But it's interesting when you quote a statistic like this, that those with the high life expectancy as well as those with the low life expectancy actually have high expectations of their government nevertheless. So read a country with a life expectancy, say in the mid-80s or late 80s, will still demand more from their government. And the demand is not just about the provision of service, it's about access, it's about affordability, it's about all sorts of things. That's been because you work in so many parts of the world, and I presume that's the kind of pattern that you see as well.
Yes, absolutely. And I think what's interesting is that there's a contradiction. So the social sectors are considered widely by the population as public goods. So when you start talking about private sector participation, there are lots of emotions, right? A number of sort of controversial topics. But in fact, when you look at the health systems, private sector is everywhere.
Yes.
So governments basically have a difficult task. And you see there are very interesting cases nowadays where governments are trying to scale up access to health, scale up their insurance system, universal health coverage. And in parallel, they realize that they have no choice. They have to associate private sector. You take, there are several examples of that, but I'm just thinking of Côte d'Ivoire with a very clear plan towards universal health coverage. But 40% of the healthcare is delivered by the private sector. I was speaking also in Nigeria, right? Because they have now a very nicely done health reform, presidential health reform. The same, they know that without associating private sector, they will never reach their goals. Egypt is also a very clear example. So you have this contradiction, and PPP is sometimes seen as a midway by governments on their way to associate private sector in a mainstream way and scale.
Yeah.
They can devise specific contract.
Yeah.
So that's how governments can start sort of fulfilling the expectations in the public sector, associating private sector to upgrade public services.
Yeah, yeah. I think that's somehow I can see that governments need to kind of move forward with the reality that they find themselves in, because what we've seen in many countries, the underinvestment in particularly social infrastructures and social sector services, has really resulted in the private sector just stepping in to fill that gap. And usually the private sector fills the gap that's easiest to fill. So they don't take on the higher risk one or more costly services. They'll take on things that where people will definitely pay, like invasive cardiology, dialysis and so on, which are more life-saving. And for the government to come in and say, we want to ignore all of that and start with our own pattern of things, really doesn't work well. You really need to take on board whatever's there with the private sector and somehow bring that into the public provision, as well as develop your own PPPs and maybe even direct public projects as well. But yes, we see that issue with filling the gap, and that then causes an issue with access, because once it's private only and you have to pay, then access diminishes because those who can't afford can't access those services. So it becomes a rather vicious circle. Conscious of the time we have, and this is only kickstarting. We have 5 more sessions, so you'll get a good flavor of the social sector today. If we can just close off by talking about the key obstacles, so like 1 or 2 key obstacles that you have faced in your wide experience in structuring PPPs in the social sector?
Yes, so look, we will have a lot of examples, I think, in the afternoon, right? Because I think what's more telling is to sort of tell these stories, these case studies, what worked, what didn't. But the number one obstacle that we see is affordability. So we are going to talk about, we are launching today a new publication, World Bank and an IFC, on diagnostics PPP. And we've studied over a year 15 cases, 15 case studies, with a lot of lessons learned. I will talk in more details also in the afternoon session. But in fact, what you see is the affordability as being one of the key issues. Some governments launch PPPs thinking that you will base everything upon out-of-pocket payments. And then you have this vicious circle. Because everything is based on out-of-pocket, it's not affordable, and then utilization of investments is not there, right? Investments are underutilized.
Yeah.
Simply because access, users cannot access the services.
Yeah.
So that's the number one obstacle that we see, and there are ways of basically reutilizing public funds that are perhaps, less efficiently used in the public sector, to sort of devise PPPs that will function.
Yes.
But in fact, you have to sort of look at the affordability very early on when you devise a project. And that's what we do. We have a first phase where we look at the probable impact and we ask the governments if they want to go ahead, right? Because we have now sort of price benchmarks. That's one. Second is that you are dealing with healthcare professionals. And these health professionals are a scarce resource, not only in low and middle income countries, everywhere in the world. So they have alternatives. And so if you don't find a way to attract them to the PPP and retain their skills, then, it's difficult to have the sustainability of that project. So if I had to mention in the quick time 2 obstacles, that's what I would say.
Yeah. I hear you loud and clear about the affordability, and we've worked on projects where we actually studied the affordability in the phase 0, as you call it, the pre-feasibility, because that really is a key decision point for the government to come to terms with what the payment structures would look like. And we've both had the experience where at the end of that, or even during a feasibility, the government gets to the point where they realize that this is a bill they can't afford. But oftentimes, the whole understanding of what the total cost isn't all that clear to the government anyway, so the benchmarks aren't necessarily with the government. Karine, there's going to be a lot to talk about. Thank you so much for coming, and it's great to have you back in the UAE. I'd like to thank Karine for her time.